Good morning, everybody, and welcome to our webinar on Horizon Europe Health Calls for 2022. On behalf of the Horizon Europe Health team, I would like to welcome you to our webinar this morning. And as you know, the calls are now open. They opened in October and they'll be closing on the 1st of February for the first stage of two-stage calls and on the 21st of April for single-stage calls. And we have great interest in our webinar. We have over 240 participants registered for today's event, and many of these have now joined us. As we have a very full agenda today, I'll be asking all presenters to keep to time as we have a lot to cover. And participants will have an opportunity to post their questions and questions in the questions and answer function, and we will answer some questions as we go along and others at the questions and answer session as indicated on the agenda. And the chat function will be disabled during the webinar. So feel free to put your questions in the questions and answers. And when we have the questions and answer session, if anybody would like, we'll unmute you if you have some questions that you want to ask. So the event is being recorded and will be available on the HRB YouTube channel, and the slides will also be available afterwards. So I'm going to give a very quick rundown of the agenda before we start. Myself and Martha Cahill will start with present for 2022, and then we'll have our questions and answer session. And then we'll have a case study on hints and tips for success from Anita Hogg from the Medicines Optimization Innovation Centre in Northern Ireland. Lucia Novo, the innovation lead for EIT Health, will bring us up to date on what's happening on the European Institute of Innovation and Technology for Health. And then the Swiss NCP, Dr. Sasha Hupen-Tobler, will speak to us about Swiss involvement in Horizon Europe, and also I'll give an update on UK involvement. And then we're going to have a short break at 11:35, and Dr. Amanda Daly from the Health Research Board, who is the national focal point for the EU for Health programme, will present the calls that are opening there. And then Patricia Clark, the national delegate for the Health Research Board, will talk to us about the cancer mission. And finally, we will have Dr. Martha Cahill speak about other health opportunities in the EIC, Digital Europe, IHI, and then Dr. James Walsh from Enterprise Ireland will talk about the European EEN network. And then we'll have another session of questions and answers. So now I'm going to share my slides and present the calls for the 2022 calls. So myself and Martha are going to present these. I will present the calls for destinations 1, 2, and 3, and Martha will present the calls for 3, 4, and 5. The first destination is staying healthy in a rapidly changing society. And for this, we have, there are 5 topics available for 2022. The first one is boosting mental health in Europe in times of change. And there's 50 million euros available for this call, and they'll be able to fund 7 proposals. And this is a research and innovation action, and it's a 2-stage application. Then we have, the next one is trustworthy AI tools to predict the risk of chronic non-communicable diseases and or their progression. And the 60 million euros available for this one as well. And the European Commission will be able to fund 6 proposals, and it's a 2-stage topic. And then the next 2-stage topic is prevention of obesity through the life course. 60 million euros available for this, and they'll be able to fund 10 proposals, and again another 2-stage. And then there's a single-stage proposal is personalised blueprint of chronic inflammation in health to disease burden, and 50 million euros available, and 7 proposals will be funded. I'm just going to go through each of the topics. And the first one is about boosting mental health in Europe in times of change. And this topic is about mitigating the mental health burden and helping people cope with the combined effects of transforming Europe, socioeconomic consequences of COVID-19, climate change, digitalization, and technological advancements. So in the scope of the topic, you're to provide a comprehensive knowledge base of how transforming Europe can influence mental health in a fast evolving society, especially in the most vulnerable populations. And also you're asked to develop and implement interventions which promote well-being and prevent mental illness to help cope and mitigate the stress of a changing society, such as I'd already mentioned, digitization, climate change, and the impact of COVID-19. And the interventions here should target relevant settings such as workplaces and schools, and also the most vulnerable populations such as children and adolescents and elderly people, and people with pre-existing health conditions and so on. So the topic is also to inform policymakers and regulators on the prevalence and burden of mental health, ill health relating to a transforming European society, digital technologies, climate change, etc., and the effects of transforming the European society. And it's also on occupational mental health and comparative cost effectiveness of the interventions and the policy choices. So there's also some additional conditions, and the research should be multidisciplinary. It should include medicinal sciences, social sciences, humanities, and the arts, and also to consider some behavioral patterns, stigma, and novel social dynamics, as well as different socioeconomic, culture, and geographical context. And the proposals must involve end users, and these would include civil society organizations, strategic partners in the design and during the course of the project. The next topic is trustworthy AI tools to predict the risk of chronic non-communicable diseases. And this topic is about employing AI tools to enable personalized prevention and to enable progress towards risk prediction and early detection approaches for chronic non-communicable diseases. And the scope of this, you have to address all of the following elements: to leverage existing high quality health relevant data from multiple sources. And that includes cohorts, electronic health records, registries. And then you have to take into account the individual's genotype or phenotype, medical, lifestyle, socioeconomic behavior, etc. And of the generation of a high quality health data necessary for the rigorous development of AI disease risk tools. Also, you're asked to develop the adequate performance metrics to assess the technical robustness of the developed AI tools. And proposals should also assess the possible inherent bias introduced to the AI tools. You're asked to develop the criteria to assess the effectiveness of the AI tools in terms of improving health outcomes and enabling personalized prevention strategies. And then to implement proof of concept or feasibility studies to validate the AI tools in a relevant end user environment or real world setting. And that's to assess their performance in comparison to the standard of care. And there are also additional conditions here. There's the wide uptake by user communities and scalability of the solutions across clinical contexts, and the action should promote the highest standards of transparency and openness of the AI tool. And also your proposal should support multidisciplinary research built on broad stakeholder engagement. And this topic does not exclude any disease or disorder. Now, the next topic is preventing obesity through the life course. And this is about testing of tools and interventions, strategies and programs and policies, and their implementation to prevent overweight and obesity. So in the scope of the topic here, you're asked to address several of the following research bottlenecks. And the first one is a comprehensive understanding of biological pathways, susceptibility to and protecting against uncontrolled weight gain. Identification of socioeconomic and lifestyle factors influencing consumer behavior. Identification of pre-obesity biomarkers and their association to lifestyle and environmental interventions. Mapping existing implementation research activities to prevent overweight, obesity, outcome analysis, and best practices. conducting a thorough meta-analysis of information from available scientific literature and identification of the relationship between the risk for overweight, obesity, and the biology of obesity, lifestyle habits, and exposures. Developing recommendations and guidelines for what constitutes a healthy diet for different ages and health groups. And then understanding the causal links between overweight, obesity, and sedentary behavior, quality and quantity and types of food, drinks, physical activity, and personality traits. Design a creative and engaging program to reach the optimal balance between diets and physical activity. And then to analyze obesity stigma, stress, and work-life balance, circadian rhythm disruption, mental health, including psychological problems, screen time, dependency, drugs and side effects of drugs, and the prevention of overweight and obesity. And then addressing inequality aspects of overweight, obesity at multiple levels, setting up pilots to assess the effectiveness of obesity management strategies, and developing a system for monitoring population indicators relevant to overweight and obesity. So there's a lot included in this topic, so it's important to read it carefully to make sure you're covering everything that you're asked to cover. Now, the last topic here in the Destination 1 is the personalized blueprint of chronic inflammation in health to disease transition. And this is a single stage topic. So this call will close in April. This is about implementing data-driven personalized approaches to identify drivers of chronic inflammation. And in the scope of the topic, you're asked to address all the following elements. You have to integrate state-of-the-art knowledge and data from suitable human studies to identify actionable factors, like linking chronic, systemic, and or local inflammation to the health to disease transition. Take stock of omics, of dynamic measurements of the health and well-being status, of data-driven analytic tools in order to identify biomarkers and other health indicators linked to the health to disease transition. You also have to understand at the systems level the human biology and physiology underlying chronic inflammation in connection to the tissues, organs, dysregulation, organ crosstalk, and hemostasis breakdown, triggering the health to disease transition, and taking into account the person's phenotype, genotype, medical history, nutrition and well-being status, lifestyle, and our occupational environmental life stressors. You're also asked to develop and utilize robust sensors, devices, and our mobile apps, and other innovative technologies. And then to implement proof of concept human studies and to test suitable interventions with the aim to demonstrate the reduction and or revision of the pre-disease state linked to chronic, systemic, and or local inflammation. So there are all the topics in Destination 1. And now going on to Destination 2, which is living and working in a health promoting environment. And there's just one topic here for 2022. And this is methods for assessing health-related costs to environmental stressors. And this is about improving the calculation of the socioeconomic costs and our benefits of health impacts associated to environmental stressors. And there's a lack of data to evaluate the economic burden of clean environments. So in the scope, you're asked to address all of the following activities as well. Systematic reviews and exploitation of the latest evidence of exposure response functions and causation, resulting from the data that has been accumulated over the past 10 to 20 years. Identification of data gaps on environment and health risk factors and health-related costs and recommendations on priorities for new data collections. Advancement of methodological rigor and consistency in accounting for morbidity and mortality and disabilities linked to the evaluation of statistical life and or life years with quality adjustments within the unified framework. And also enhancement of the understanding of the role of discounting and other methods for weight, present and future costs and benefits. So you're asked to develop innovative tools, methods and models and associated guidelines for health impact assessments and cost benefit analysis, and also to develop case studies improving public authorities comparing the cost of action and non-action, and then to deliver fair data and user-friendly access to an open knowledge base. Then we come to Destination 3, which is about tackling diseases and reducing disease burden. And in this destination, there are 5 topics open in 2022. Two of those topics, they're the pandemic preparedness and the non-communicable disease risk reduction in adolescents and youth will open in January. And the other one is, the last topic is for support for the GLOPID or Secretariat. And for the first topic here, there's 60 million available and 40 for the next one. And then for development of new effective therapies for rare diseases, there's 60 million available. So the first 3 topics are 2-stage topics and the second 2 are single-stage topics. So the next topic is the preclinical development of the next generation of immunotherapies for disease or disorders with unmet medical needs. And the scope of this, the proposal should build on existing knowledge in the field. You should develop preclinical study of new immunotherapy agents in vitro and in relevant animal models. Off-the-shelf therapies will be considered as an asset during the evaluation, so if you include that in your proposal. And also you're asked to do proof of concept or first-in-man human studies for testing the new therapies. And these should address as appropriate the therapy-related potential of adverse side effects. And then phase 2 studies or later phase trials will not be supported. And a standardized framework for assays and data usage to enable a robust assessment of safety and efficacy. And you should also include a pathway of the necessary steps to ensure sustainable therapeutic agent production, considering intellectual property management and uptake by health systems and rapid access to patients as well. And passive and inactive immunotherapies such as antibody-based and RNA-based and cell-based therapies are allowed in this proposal as well. They're covered in this. So in addition, the regulatory and health technology assessment HTA strategy should be in place at the start of the proposal. And what's excluded are preventive vaccines, the immunotherapies for rare disease and cancers, and the repurposing of drugs are excluded from this topic. And the use of nanobiotechnology infrastructures platform of the JRCC should be considered to use that also in your proposal. The next topic is a 2-stage topic, and it's developing the next generation of vaccines. And this is to ensure that the most effective, accessible and affordable vaccines against all major infectious diseases become a reality. And in your proposal, you should aim to diversify and accelerate the global vaccine research and development pipeline and to strengthen the current lead role that the EU in vaccine research has in vaccine research and development. And then to develop pathogens which still lack vaccine sufficient efficacy, but where earlier efforts have already produced promising vaccine candidates. Then innovation, integration of expertise and capabilities, including alignment of preclinical and clinical models, biomarker studies, new vaccine approaches from discovery to late stage development, and from bench-based research to clinical development of promising preventative candidates. And then also to include application of iterative processes to allow exploitation and integration of novel findings between clinical, preclinical, and discovery research and development. And you're also asked to decipher mechanisms of protection of candidates, new approaches to antigen discovery and immunogen engineering, reverse vaccinology, evaluation of vaccines in novel platforms. And also innovative vaccine manufacturing approaches, relevant animal models, evaluation of alternative vaccine delivery routes as well. And then effective evidence-based decision-making for progression of the vaccine candidates in the pipeline based on transparent and objective portfolio management. And the next topic again is 2-stage, and that's development of new effective therapies for rare diseases. And here you're asked to develop therapies for rare diseases with no approved therapeutic option. And you're asked to focus on groups of rare diseases with commonalities and such as shared biological features, possibly within the same and or across different medical areas within the rare disease landscape. And the therapies that are to be developed may include a broad family of therapeutic interventions, such as small molecules, advanced therapy medicinal products, repurposing of existing medicinal products, including non-pharmacological interventions or their combinations, and of different stages in the continuum in the innovation pathways. And you're also asked to have multidisciplinary collaborations between all relevant stakeholders. And also to develop preclinical models and our innovative tools and technologies to verify molecular cellular pathways, genes that can be therapeutically targeted, and this will increase confidence in the target selection and or perform toxicity studies. We're also asked to develop innovative clinical trial designs for small populations and novel approaches to assess and monitor the safety and efficacy of the proposed interventions, and to carry out preclinical proof of concept studies and multinational interventional studies. And this is to demonstrate the safety and efficacy of the therapeutic interventions under study. And then there are a few additional points. Rare infectious diseases and rare cancers are excluded from this topic and will not be considered. And also clinical development, you must have orphan designation at the latest on the date of the call deadline. Good practices for analytical methods and preclinical models developed by the EJP on rare disease and other relevant EU-funded projects should be considered as well. And the involvement of patient representatives in all phases of the research and development process is strongly encouraged. And then involvement of the JRC and tools and services provided by the European Platform on Rare Disease Registration should also be considered. So this topic is quite substantial as well, so it's important to read the full text of the call topic. The next one is a single stage call, and it's on pandemic preparedness. And this one is contributing and complementing initiatives such as the European Partnership on Pandemic Preparedness and the Health Emergency Preparedness and Response Authority, HERA. It's addressing priority research and innovation gaps also identified by member states, so that would contribute and support the establishment of HERA, and also research focusing on pathogen X and horizon scanning for the identification of potential medical countermeasures and innovative technologies, including the development of standard research protocols. And there will be 3 projects funded in this area, and there's 10 million euros available. And the final topic in this area is the non-communicable disease reduction in youth and adolescents. And this is a single stage topic as well. Implementation research about common risk prevention interventions targeting adolescents and youth to reduce the impact of non-communicable diseases in low and middle income countries and in vulnerable populations in high income countries as well, to be considered in the topic. And young people, which the World Health Organization defines as the period from ages 10 to 24 and includes adolescents ages 10 to 19 and youth 15 to 24. So this topic should involve evidence-based interventions that promote healthy behaviors and that have the potential to profoundly reduce the risk of chronic disease and multimorbidity. And applicants are invited to consider interventions at the individual, family and community level, such as work or school, or the population level. And interventions and strategies must include, but are not limited to, those in the following 3 areas: nutrition, physical activity, and physical activity, sleep, tobacco, substance abuse, and or alcohol use, social well-being and loneliness. And proposals should include implementation research outcomes and, where relevant, include service outcomes. Funded teams are expected to use explicit indicators and measures of project context, reach, outcome, evaluation, and scale-up potential of their plans and protocols. And proposals should include a strategy to include policymakers and local authorities, as well as other relevant stakeholders, such as community groups. And there's 25 million available for this project, and about 3 proposals will be funded. So I'm going to stop here now, and Martha's going to take up destinations 4, 5, and 6. Thank you.
Good morning, everybody. I hope you can see my screen. So I'm going to take you through destination number 4, 5, and 6. So first off, just a little bit of a resource that you can use. The Commission themselves have done a very, very good overview of all of the destinations, the expected outcomes, scopes of all the topics, and they have Q&A videos as well. So this particular slide links you to all of those resources, and you can take a look at that. And there's also some information on clinical trial studies and the gender equality as well, which needs to be addressed in your projects. So destination number 4, this is about ensuring access to innovative, sustainable and high quality healthcare. In a nutshell, this is about the modernization of the healthcare system. There's 3 topics in 2022. I have the challenge of explaining these unique instruments, which is a PCP and a PPI to start with. These are focused on the procurement people within hospitals, whether they're private hospitals, national authorities. So I'm going to go through that in a minute. The 3rd project here is better financial models for healthcare system. There's a very similar one in destination number 6 as well, and we're going to talk about each of these in detail. There's 40 million for this PCP and the PPI, so that's quite a significant level of funding there. So I have used the Commission slides wherever possible. So this is a very good illustration of, I suppose, the level of funding per project. So there's 25 million dedicated to PCPs, and that's 5 million per project. And the same with the PPIs, 15 million and 5 million per project, and 30 million for this particular project here, and 5 million per project. Now, so I'm just going to start with the PCPs because this is a little bit more complicated. As I said, this is about public sector and private procurers where they get together to form a consortium. They look at what are their challenges and common needs or unmet medical needs, and they basically can apply for a project in this particular area. Following that, if successful, they have an option. Basically, they can either use the PCP instrument or a PPI instrument. Now, just to explain, a PCP is pre-commercial procurement. This is used where there is no available solution for what they need, all right, to address their challenges. And in this particular case, what they will do is they will tender for a solution, and an R&D contract is awarded to the winner. Okay, this is 100% funded by the Commission. So this is a very useful instrument for healthcare system or healthcare, anyone in healthcare and procurers. Okay. In contrast to the PPI, it's only 50% funded, but generally there's a solution available which may need to be adopted. But what happens here is they are running pilot projects within the hospital, and basically the hospitals or procurers provide them access to carry out this pilot project. Okay, so that's the difference between each of these. So just when you take a look at the text for them, they're very, very similar. They're both focused on building the resilience of the healthcare system in the context of recovery. So you can target your projects around any area that fulfills this criteria. These could be even moving to remote care. It could be kind of maybe even something like dealing with the backlog within the systems. You know, maybe screening and monitoring, anything that will alleviate that pressure pressure on the hospital systems. There's very little difference between the PCP and the PPI, except for one thing. You need that balance of funding to be secure. So in our case, say if there's a hospital, the hospital systems, the HSC need to back this with their own additional funding so that it's available to fund to 100% on that call. So that is the difference. And those who win the tender will get 100% regardless. Okay, so that is the difference there. Now I'm going to talk about the third topic, which is looking at better financial models for the healthcare system. So just to highlight the main things that need to be covered here, pretty much this particular topic is looking at, it's trying to address the rising cost of healthcare right across Europe, okay? Year on year, there's increasing and escalating costs for healthcare. This is looking at better financial models and financial planning within the hospital systems. It's looking at cost-effective spending and strategies, and also looking at remuneration and contracts, and also incentivizing staff, etc. Now, one thing I am going to draw attention to as well, in each of the expected outcomes and scope, sometimes it says address all of the following, and basically if it's all of the following, you need to address all of the bullet points that are laid out below that. And in this particular case, the scope says one or more of the following. So you don't have to address all of these, but I'd be aiming for about 70–80% of the bullet points, okay? Now, one thing I will say about this particular topic, it does not address healthcare technology. So this is unique to the financial planning and to basically recruitment, remuneration, and cost effectiveness, but it's not financial or digital tools or pharmaceuticals. This will be dealt with separately in a topic in destination number 6, and I'll go through that in a minute. So now we're on to destination number 5. This is about unlocking the full potential of new tools, technologies, and digital solutions for a healthy society. There's 3 destinations here, or 3 topics here. Okay, so both the first 2 are single stage, and the second one is a 2-stage call. Now, so just to explain, I suppose, why there's 2 stages versus a single stage. Generally, they're expecting a greater number of applications in a 2-stage project. So what they do is they screen them, and they kind of almost like triage the amount of applications they're going to get. So that is the logic behind what is happening there. I'm going to go through each of these in a second. So there's the level of budget and funding, and I suppose just a point, the last 2 are related to data, but we'll talk about that in a second. So again, you have the breakdown of the budget for each one. So 60 million, 10 million per project on the first one. This is dealing with companion drugs and prescriptions, and the second one is on data and computational. So you can see the budget breakdown there. Okay, so the first project is optimizing the effectiveness in patient of existing prescription drugs for major diseases except cancer. And actually, when you read the text, it also excludes rare diseases and with the use of biomarkers. Okay, so again, just take a look at the text here. All right, so it's all of the following. So everything below the expected outcomes, all of the bullet points need to be addressed. Now, just to explain the concept of what is going on with this project is it's looking at companion diagnostics. So this could be genomes or biomarkers. And what it does is if you have a particular gene or biomarkers, you basically have a companion prescription drugs. And this is all about targeting diseases so that you have a better health outcome. So it's kind of moving down the line of personalized care and personalized medicine. So you're screening for different biomarkers and so on, and then you're applying different types of prescription drugs. The objective of the project here is the clinical validation of these biomarkers. So you're basically lining up these companion drugs, these companion biomarkers with companion prescription drugs. You need to take care with this one though, because it's not about the validation of the biomarkers. This is not about bringing new biomarkers to the market. So that is one thing that you just make sure that is not happening there. It's about basically the clinical validation of the companion drugs and looking at the outcomes of the projects. Okay, so now the next one is project is on looking at new methods for the effective use of real world data and or synthetic data in regulatory decision making and or in health technology. a bit of a mouthful, but basically this whole world of real world data and synthetic data is coming up quite a lot. And what you're looking at here is, again, take note of the language. You're looking at utilizing things like digital twins and omics data, and basically applying and extrapolating that type of data. So if you have a certain type of genetic profile, or you have a genetic twin, you're extrapolating what will happen in terms of treatment and care. Now that is all very well and good, but basically we also have to validate that to make sure that it is trustworthy, and it's the use of trustworthy machine learning and AI. So if you're making, I suppose, decisions based on, you know, a digital twin, you also have to make sure that you are doing this in an ethical way and that you are making trustworthy decisions. So that is the whole focus of this entire project. And again, you're building in machine learning and AI into these projects. And again, you also need to address how you apply that AI and the kind of ethics around how you apply it, the algorithms, etc. Okay, and we can talk a little bit more about AI in the Q&A, because there's a few things there that you should keep an eye on. The next project, I quite like this project. It's kind of a bit of a hidden gem. It's on computational models for new patient stratification strategies. Again, a bit of a mouthful, but it's about essentially making strategic decisions about when you treat patients and how you, I suppose, triage patients in a sense. Again, it's utilizing things like a digital twin, machine learning, disease models, or virtual physiological humans. Basically, how do we make decisions? Who is more likely to progress towards disease, and when do I intervene and with treatment and care? Okay, again, just take a look at all of the following needs to be addressed and several of the following. So this is quite a lengthy topic description, so you just need to keep an eye on that. But again, a very interesting project if you're in the area of machine learning and AI, but it's kind of hidden under quite an unusual title. Okay, then, oh yeah, so also just to be aware that clinical validation and preclinical studies and clinical studies are built into this. So you should be moving towards that decision making and the utilization of that machine learning and AI as well. So you may have to complete the clinical trial documentation in that as well. Okay. So destination number 6 is about maintaining an innovative and sustainable globally competitive healthcare industry. Now, this is my longest destination, but hopefully we'll get through it relatively quickly. So again, the very first topics, they're all AI, which is all research and innovation actions. So they're all research projects. All of the topics are single stage. And then we have 2 CSAs at the end. The 2 CSAs, basically, there's only going to be one funding, so that's worth keeping an eye on. But they're nice little projects if you're lucky enough to get involved with it. I call CSAs the building blocks because they often lead into other activities in the future. So again, the budgets are here, and I'm going to skip past this. As I said, the CSAs, there is only one going to be funded, so you just need to get in with the right group on this particular one. So the first one is on enhancing cybersecurity of connected devices. So again, things to watch out for here is that this is essentially about looking at what are the existing guidelines for connected devices. Now, if you take a look at the footnote in this particular topic, you will actually see a whole load of references to existing guidelines, medical devices, connected devices, etc. So you should be aware of all them and looking at all of them in terms of best practice and guidelines. But what the project is entirely focused on is next generation technology. Is that where do we need to address future gaps? So, I mean, you're going to have new technologies such as 5G, remote internet connections, remote monitoring, remote access, home care. All of these things are going to change how we use devices. So this is, I suppose, the entire project is focused on how do we make sure we keep up to date with this. They talk a lot about novel methodologies and toolboxes. And again, that's about how do we keep monitor what is best practice and utilize and basically make recommendations to the future. So actually, one thing I'm going to say about this as well is if you take a look at the text on this, it also makes reference to introducing you to, and I think this is going to be the JRC. I'm going to talk about this in my last slide, but essentially what they're looking for here is recommendations that may influence future policies. So they are very interested in the outcome of this project because it may determine future guidelines. So next project is on scaling up multi-party computational data amortization techniques and synthetic data. Again, that's your synthetic data coming up there. What this is about, okay, is it's about prevention. Okay, so this is about data and how we utilize data. So there's a big push to reuse existing data, whether it's in treatment and care, but also what you have is there's a chain along the healthcare continuum that basically everything from your GP to your doctor, there's a handover of information or certain information. So it's everything from prevention to diagnosis to treatment. There's a transfer of patient data and information, and how do you make sure that this is done seamlessly? This also looks at third-party access to data. So how do you allow a third party, for the purpose of research or utilizing it in a different way, access to that data, but not affect the underlying data or provide personal information? So this all needs to be GDPR compliant. Now, what they also want you to look at here is, I mean, you want to take that data, use things like AI, but that data needs to be anonymized, okay, so that you're not accessing patient data. But also what they want is that code of, you need to be able to feed that back where possible so you can trace back into the individual, again, for the betterment of treatment and care. So that is, it's that cold feedback loop with the data and the use of data while still protecting the privacy of the individual patients and care. Okay, so the next one is on, this is the one that I mentioned earlier on, very similar to the topic on in destination number 4, except this particular one focuses on healthcare technologies and pharmaceuticals. So there's new pricing and payment methods for cost-effective and affordable health interventions. It focuses on the healthcare technologies and pharmaceuticals, as I mentioned, looking at value-based pricing, equitable access, new reimbursement models, and also just bearing in mind that green impact. So I think here is a good place to maybe mention software technology. When it's utilized now within the healthcare system, is often is priced differently. It can often be priced on a per user basis, per patient basis, and also this particular move towards remote care will also actually affect how pricing is done and how purchasing decisions are done in the future. So that's a nice little project if you're interested in this particular area. So next particular topic. Okay, so this is second to last, is the setting up of a smart European innovation hub. Okay, so only one project is going to be funded here. This is about linking together innovation hubs in the area of health. And basically, it's about sharing knowledges and best practice between it, promoting healthcare solutions, and again, allowing, I suppose, access to healthcare solutions within the hospital system, greater patient engagement, and also the added learning from networking and collaboration. So one thing to note about this is there's a few references to existing hubs in the footnotes. There was more in the earlier drafts and versions of the work program. So if you're looking for this, I can link you to those earlier innovation hubs that are mentioned in the original draft. So happy to talk to anyone on this again. So this is my last topic, and it's about setting up electronic health record exchange format ecosystem. Now, this is not about the development of technology itself. It's about the adoption and promotion of electronic health record exchange, okay, and the infrastructure. Now, what is important here and why this project is important is the European Commission have set a goal in the 2030 Digital Compass on e-health, where 100% of all citizens citizens within the EU will have access to their own medical health records. What this means is that I, as a patient or as an individual, can have access to my own medical health data from my doctor, their GP, to my imaging, X-ray results, everything. So everything needs to start talking to each other. And this needs to be a pan-European infrastructure. So what they want to do is to ensure the adoption of this particular electronic health record exchange. Okay, so that is the focus behind that particular activity. And again, only one of these CSAs are going to be funded. Now that's the end of the topics, but I'm just going to mention the JRC. The JRC is mentioned in quite a few topics, 4 in 2021 call and 5 in the 2022 call. And just in case that's confusing, it's not intended to be. The JRC is a group within the European Commission that is basically deals with research and policy initiatives. And what they want to do is link you with these, but it is not something that you need to be worried about in the context of your project, because the JRC will not be a beneficiary. That introduction may happen afterwards. So you can actually see in some of the text, they will facilitate introductions to the relevant parties within the JRC. They won't be a beneficiary, but they're interested in the outcomes of your project from a policy perspective or future research perspective. Okay, so that's just to explain that. Okay, one of the questions in the chats earlier on, I noticed, was in relation to deadlines. The single stage calls, they opened in October. They will close on the 21st of April. They're 45 pages long, very strictly 45 pages long. If you are doing a 2-stage call, the first stage opened on October, will close on the 1st of February. Now, after that, these will be evaluated. It's a go, no go situation, and you should get the results in around May, and then you start the second stage with a full proposal that's 45 pages long in around May and closes in September. Now, just if you're interested in the 2-stage call, the first stage is only 10 pages long. There is a shortened template for that particular application, so just be aware of it. You can click on my slides, you'll get it here. And the other thing to be aware of is in the general annex, it will tell you how it's evaluated, because not all 3 criteria for evaluation will be applicable, only the first 2, which is excellence and impact. So you need to take note of that. Okay. Now, I also want to just mention, this is my last slide, bar 1, it's our financial supports are still available. You can put in applications if you're coordinating a grant. This is the link, and happy to talk to you at any stage. And also, I highly recommend you get onto our newsletter, which is on horizoneurope.health, or horizoneurope.ie/health, or on the homepage, you just click the health button. And basically what this is us trying to put out as much information as we can and trying to update you as fast as we can on new changes that may also affect you. So this is my last slide. So I am finished, and thank you for your time.
Thank you, Martha.
I'll stop sharing.
Thank you. Now, we're going to have our questions and answers, and this will be facilitated by Patricia Clark from the HRB, who's the National Delegate for Horizon Europe Health. And I think I see questions in the chat and also questions in the questions and answers, as well as in the chat. And I've answered some of the ones in the questions and answers. So over to you, Patricia.
Yeah, good morning, everybody, and welcome. I think you're probably overwhelmed with the amount of detail in those slides if you're not already familiar with them. And thank you very much, Kay and Marta, for all of the details that's there and the resources that people can access as well. I mean, looking through the questions, I think some of them related to Destination 3K, which have been answered online, related to the deadlines, the confirmation whether cancer can be included in some of the rare disease topics. And then there are questions in the chat around the deadlines for the call, which I think, Marta, you have covered in your slides. A question from William Farrell about older members of society and where they can actually plug into calls, and I think that was in relation to destinations 1 to 3, and also a question on the collaborators for the pandemic preparedness call. Kay, I think, can you mention something about the pandemic preparedness call?
Yeah, the pandemic preparedness call, there's very little information there. There was a CSA in the call that closed there in September. So I think it'll be a matter of waiting for the outcome of that, even though this call is not opening until January, and the results of this calls that closed in September will be available then. So it's not opening until then. So there'll be an opportunity to see the results of the CSA. And the question was, Patricia, sorry, that it was about
just whether there was a need for collaborators for that call.
Oh yeah, because it's a research and innovation action, so there would be a requirement for collaborators. The same, you have to have your minimum 3 applicants at a minimum, because and the topic, to recall the amount of funding available for the topic, it will require a number of collaborators, certainly, and they're looking to fund 3 proposals.
I think as well, Patricia, is that that the CSA could, the group that are involved with the CSA will very likely be looking at that particular call. And that CSA at the time in 2021 consisted, of a lot of member states representative, if I remember correctly, because they were nominated to participate in that CSA. So it's kind of a unique one. It may be that they're looking at this RIA as a continuum of the activity that comes up in the discussions for the CSA. So it might be a little bit of a hard one to get involved with, but it doesn't mean it precludes us from trying. If a quality proposal goes forward, I think it could be evaluated favorably.
Yeah, because they're going to be able to fund 3 proposals in that topic.
Okay, just something on the citizen science. I think somebody had mentioned that there's a lot about citizen science, but Ireland hasn't done much to support the development of citizen science. Would you agree with that? Or are there options within the call specifically on citizen science? I mean, I think Sean Lynch, who raised this question, has come back and said it's just an observation, that there's huge potential really for public health policy and resources, but there aren't really opportunities for involvement.
I think, previous to this, it was involvement of patients and carers and all of that and so on, and society in general. But I think they've changed the terminology now to call it citizen science, and I don't think that would preclude, the inclusion of society at large and patients, because all of the topics do want involvement of citizen science in the proposals.
Okay, good.
I think you'll see it in the text more so than on the expected outcomes and scope, which we've focused on today. I think it's almost a given. Patient engagement and citizens engagement is built into the projects, and I think if you search the main document, you will see that. So I don't think it's excluded. I just think it's kind of a given, and it's built in there.
Okay, got a question on the JRC. Will the JRC act as an associate partner to assist with dissemination? No,
it's not proposed. They're not going to be a beneficiary, but they are interested in the outcome. So it may depend. In some of these topics, you have you have kind of information events and networking events, so they may get involved at that stage. So it may depend on the project, but typically, they're not going to be actively involved in anything, but they are interested in the outcome. So that may depend.
Okay, a question on the 2-stage calls and the actual format of the applications. For stage 1, if there's only impact and excellence are being evaluated, then why is there an allocation within the 10 pages for implementation? So
I hadn't spotted that, but look at the general annex. Okay, so the general annex is the guide to the first stage and the 2-stage calls. Okay, so there might be some details in there, but the general annex is your guide there. And I remember just sitting down to read it. It's been a while since I've read it now, so it may have been an early stage draft. But my understanding was for the 2-stage calls, it'll only have 2 criteria, and the general annex that I linked on my slides will be where you need to go, or on the topic topic page. All the documentation's on the topic page. And if you don't have that template, you can download it. As soon as you go to log in as a coordinator, you can download the template, okay? So if you don't get access to my slides, you'll get it straight away as you log in for a 2-stage call.
Yeah, and it would only, it should only be the 2. I know they're having some glitches because there was, they've also, for the first stage of the 2-stage, they had an opportunity to upload a document on ethics, but that, I think they're going to take that down because that wasn't meant to be there. It's only meant to be there for the single stage or the second stage of a 2-stage. So I think there's glitches with the system.
Okay, great. And the final question in the Q&A box is really around the specific topic, Horizon Health 2022 Disease 06. And there's a sentence in it: the proposal should include proof of concept / first in human studies for testing of new therapies. And just a really understanding of what they sort of / means here. And how it should be understood, whether it's an or an and or a alternative. Very specific. I'm not sure which of you covered that topic.
Yeah, I covered that topic. I think, I need to go back and look at that and try and interpret it, because I don't have it in front of me now, but I will answer that question by email when I take a look at the topic, if that's okay.
Fantastic. Final questions, those in the chat, is around the estimated success rates. I mean, whether you expect a huge interest for these calls, will it be in line with the Horizon 2020 success rates?
Hard to say. One area that was very, very topical in the first round was the one on clinical validation of artificial intelligence. I think there was about 6 projects to be funded in that, and there was 112 applications. Okay, now I did say I'd mention something about AI, and I will. We've had some early discussions on the 23-24 program, and that's happening at the moment. And AI is going to be built in, just like almost like proteomics. It's a horizontal team now. So what you're going to see after 21-22 is that there isn't going to be specific topics. You know, looking at AI, it'll just be something that you build into your project if you can. Okay. The other thing I would say about that particular slant on a project as well is you do need to address this now in your ethics section, and you need to look at the regulation for AI. And just from experience on my first round evaluating projects in that particular call is that we didn't do a good job of telling us, of explaining how we apply AI. A lot of it was focused around the gathering of the data and not the algorithms and how you come up with statements and how you apply that AI, because you're basically extrapolating and making statements about how, you know, what factors are affecting AI, and those algorithms can have different outcomes for patients. So more detail is needed in those particular topics. So sorry, that's a very long-winded answer. We don't know the outcomes of the first calls yet, but I just wanted to mention that AI aspect as well, because I think it's really important. If anyone is in this space going forward, it needs to be addressed a little bit better, and then we should have a better success rate for those type of projects.
Okay, and just to add to that, we expect the outcome of the first set of annual calls in the end of January and beginning of February 2022. We should have a better understanding then of the actual interest in Horizon Europe calls. I'm going to draw this Q&A session to a close. I just want to make sure we keep on time at this stage. I do appreciate that there were 3 hands raised in the from 3 different people. Can I ask that you try and put your topics into your questions into the Q&A box, please? And if not, we can come back to you again if there's something really burning that you want to talk directly about in the next Q&A session at the end of the second session. Thank you very much, and I'm going to hand over now to Dr. Anita Hall.
Brilliant, thanks Patricia. And good morning, everybody. I'm absolutely delighted to be able to share some of our tips and experiences of European funding, and it's going to be a very practical run through our experience. So I'm Anita Hogg. I'm one of the leads in the Medicines Optimization Innovation Centre, and for anybody who hasn't heard of MOIC and doesn't know what we do, this little clip will explain all. So what I'd love to do is share with you our tips across these 5 key areas. And we're going to start with finding partners. So how do we find partners within MOIC? Well, I suppose the first thing that we do is build networks, and we have an extensive network across Europe and further afield, because a lot of what we do here within MOIC is very applicable across Europe and globally, in fact. And what we do is disseminate widely. We get out there and do the legwork, publications and papers and conference presentations, but also we have a well-developed hosting program where people can come and spend time with us, maybe a day, even up to 3 months, and do a project with us, and then take that learning back to their own jurisdiction. But we also seek external recognition for our work as well, both across individual countries like Poland, Estonia, Spain, but also in some of the pan-European organisations like the European Association of Hospital Pharmacists. And we have been identified as a centre of excellence across Europe for medicines optimisation. So get out there and get the external recognition. But also we need to create networks locally, because if we're going to do projects, we need to have people on the ground to help us undertake and execute these projects. And we have extensive local networks across Northern Ireland, across health and social care, SMEs, charities, academia, and so on. So what about identifying the call topic? Well, in our experience, often it's our networks that will come to us and will mention an idea that they have and see if we want to get on board. But also, please do get on to the EU tender portal, get on there, navigate around that and see what calls are open. And you've been great in attending this workshop this morning, so you've got lots of information on there. But also, can I really recommend your national contact points who've already been speaking this morning? They are an excellent resource. Let them know who you are and what your strengths are. And it means if there are calls coming up or if people are looking for partners, they know to think of you. So what about writing the proposal itself? Well, the first thing to say is be absolutely flexible. It will depend on the consortium what your role will be in writing the proposal. Make sure that you've got committed partners who are accountable and are excited about the project, because if you don't have partner commitment up front, then you will not have partner commitment if the project gets funded. Make sure that you're well organised, that you've got dates and diaries for consortium meetings, and I would suggest weekly, and make sure that there are clear actions and everybody is actioning what they're supposed to action. Make sure you maximize the lead-in time, because I assure you that time absolutely vanishes, and leave nothing to the last minute. Make sure you get onto the portal and in fact start populating information into that portal as soon as you can, not a week before the deadline. And remember, you may need additional information, for example, a PIC number or a participant identification code. So make sure there are no surprises, get all of that information together. As Kay and others have already mentioned this morning, make sure you know the grant requirements and make sure you align to the specification, because it is so easy, particularly if you've got a broad consortium across Europe, it's so easy to lose focus and go up a different garden path and end up miles away from where you started. So keep coming back to the drawing board. Go for a strong consortium, but also strong consortium leads and work package leads, and make sure that you're aligning the partners with the relevant work packages where they can bring their expertise. Make sure you're aware of all of the very significant differences across Europe in structures, policy, practice. So for example, pharmacy is very different in Poland and Estonia from what it is in Northern Ireland. Do the legwork work around Europe. Make sure you know what topics are hot and what's not. So for example, in medicines in pregnancy and breastfeeding is really topical. Also across Europe, you'll hear a lot about legacy, harmonization and impact. Be very up on those. Make sure you're open and honest and sensible and realistic. Make sure that you're defining deliverables that you can actually deliver, because if it's in there, you've got to deliver on it. And remember, there can be miscommunication across Europe around terminology, and that can happen a lot within pharmacy, and remember, there can be very big differences in that. So be familiar with the portal. That is probably one of the best pieces of advice that I can give you. What about the budget? Money, money, money. Make sure you've got your finance team in right at the start. Engage them at the very beginning. Make sure you know what the maximum available funding is and what the funding level is, because not every partner may get 100%. Make sure you know what costs are eligible. So for example, cost funding doesn't fund the research, only the networking. The building block of the budget is the per person months, and there are a number of ways to calculate that, and there can be quite healthy negotiation, particularly up to last minute within the consortium around the budget. But most of all, be realistic. Money, like time, just absolutely vanishes. So what about the gap and signing the agreement? The first thing to say here is it can be a little bit gobbledygook. There are layers, F signs, L signs, COCOs and so on. It's a bit of a maze and a minefield. Make sure that you're aware that these roles need to be identified and need to be filled. And do start to think, even at the proposal writing stage, who in your organisation will be undertaking these roles. And within MOIC, we found that quite difficult at the beginning because it was very new for us, but it's really important for good governance of these projects. So what about the bad news? We've had a number of unsuccessful projects, but what I would really encourage you to do is to keep going and do not get downhearted and give up. Review the feedback, keep connecting with your partners, and then resubmit or repurpose for another grant, but keep the momentum going. And we've had a number of successes, both with Horizon 2020 and Interreg and others. For example, our Sympathy project, iSympathy project, and our Shapes Horizon 2020 project as well. So where are we now within MOIC? I'm delighted to say that we submitted our first Horizon Europe project call on the 21st of September, which is etched in my brain. And we're working hard for the next calls with a deadline of April 22. And it keeps going on, keep the momentum going. So what are my final tips? Make sure you draw on the experience of others. People are really eager and willing to share. Seek help if necessary. Use your national contact points. You're a wealth of information. Be realistic. Start small. So for example, at the start, there's no way we would have led a full consortium. Start small and be realistic. Partner well and keep progressing. As you've heard already this morning, it's highly competitive. In our last call that we submitted for Horizon Europe, there are only 5 projects being funded. And we could have just said, oh, well, that's not a very high success rate, so we'll not bother. Get in there, keep going, and keep the momentum going. You will find that some of your projects will score highly, but they'll still not be funded. Again, do not be downhearted, but absolutely go for it. So I hope that you find that helpful. Please do get in touch if you would like more information on our work or some of our experiences. And what I'd love to do is just leave you with this and really encourage you to keep going and keep knocking on the door and keep progressing. So I'm going to hand back to Kay now. Thank you so much for listening.
Thank you, Anita. That was very uplifting for this morning, and hope it encourages all on the call to apply for funding. Now, the next speaker is Lucia Novoa, who is the Innovation Lead in EIT Health, and she's going to talk about EIT Health to us and to explain what it's all about. Thank you.
Yes, good morning, everyone. Can you see my screen now?
Yes, we can.
Okay, perfect. Perfect. So first of all, good morning, everyone. We are very excited to be here for this session. And I would like to thank the organizers for inviting us today and giving us the opportunity to introduce our team from EIT Health Ireland, UK. So mainly what I want to share in this 15 minutes today, because it's the opportunities that you can find in the EIT Health in general, because, I'm gonna summarize a bit since there is no time for more, but I leave my contact here in case you have any questions, doubts, or want more information about any of the programs that I'm going to detail in a bit. So please don't hesitate to contact us. So I'm going to start by explaining where EIT Health comes from and what we do. I know that many of you already know us, but for those who don't, the EIT Health belongs to the EIT, which is the European Institute of Innovation and Technology. Specifically, we are working in the health sector. And the EIT Health was established in 2015 to solve some of the biggest health challenges. Here in this slide, you can see our vision to empower citizens to protect their own health by improving healthcare systems through advances in education and technology. And our mission that is being Europe's leading health innovation network by 2030, facilitating longer, healthier lives and more sustainable health system. So vision and missions are aligned with our main objectives, of course, that are strengthening health systems at the European level, contributing to a sustainable health economy in Europe by creating new jobs, and bringing innovative products and services to the market. EIT Health is located at the European level in different countries. Our structure is through regional innovation hubs. Here you can see the different hubs that we have. We have hubs in Scandinavia, Germany, France, Austria, Spain, and we have two InnoStarts, which includes several countries from different parts of Europe, and corresponds here the pink dots that you can see in the map. And I also want to comment that the EIT Health headquarters are based in Munich, in Germany. So now I'm delighted to introduce here my colleagues from the EIT Health Ireland, UK. This last year has been a year of transition and changes, and the team has been reinforced with new and recent incorporations, with the aim of having experts in each of the areas that are key to the development of our objectives. So this is the team, and you have all our contacts on our website. And here in this presentation, I also leave you the emails of some of us. And what do we do? Well, our greatest value as EIT Health is undoubtedly the network that has been created, formed by different partners as a partnership where many public and private entities, universities, research centers, industry hospitals, etc., have joined us. So what we do is bring together all these fundamental actors to drive this change in the health system and bring new innovations, new product, service to the market, uniting all the actors in the value chain. So I want to talk a bit about our main approach. Our approach is focused on this triangle that you can see in the screen. We name it the triangle of knowledge, which it has its three vertices that are research, business, and education. So you will see that all our activities and programs take this triangle into account, and it's very present in everything we do, because we really believe that this is the really way to promote real changes. For example, education skills are the basis for developing research and reach the business sector. And at the same time, the business skills are necessary in the education sector to develop innovative research. So I'm sure that you agree with me with this, that everything must be connected in the entire ecosystem. And this is our main approach here in the EIT Health. And following this approach and this triangle of knowledge, our programs are divided in 3 main pillars. We have the innovation pillar, which is for promote these new solutions to the market and change the shape of health system to make them more efficient. We have the acceleration program pillar that shortens the time to market for entrepreneurs, startups, and SMEs, while creating new jobs and contributing to a thriving health economy. And the education pillar that engages learners across, well, all the society, since citizens to healthcare professionals. Now I would like to present, after this introduction of the EIT Health, I would like to present the programs that we are going to open soon or that are open already. So here in this slide, I like to share with you this open call in the education pillar, which is the Higher Education Institute initiative, which helps these higher education institutions to promote the capacity for technological innovation and entrepreneurship. There are a series of requirements, like, for example, 3 or more European countries have to be involved. But anyway, you have here, I left the link here in the slide, so you can find all the information about it right here. And relating with this, I like to highlight here one successful example that we had on this call. The National University of Ireland, Galway, this university won 1.2 million euros in funding under this program with a pilot project named Idea to Impact, addressing capacity and capability to foster entrepreneurial thinking and actions. So in this case, if you are a university, if you are a higher education institution and you have ideas, projects that can fit on this call, I really encourage you to look in our website about the requirements and having in mind that the deadline for this call is going to be the 28th of February, 2022. Here we have some other calls for the education pillar programs. We have summer schools and I-Days that have been developed during this year, and the next calls will be launched soon for 2022. We also have boot camps and lively fellowships, which we also have the information available during the first quarter of 2022. And we are working on it because we are at the end of the year and we are working in the final details of all the programs and calls that we have. But for more information on this education pillar and calls, and be aware of the main deadlines, of course, please contact my colleagues that are Graham Hermitage, Collaboration Lead, and David Pollard, Education Lead. Then for the acceleration pillar, I like to mention that we have 2 stages through the year. We have different calls, events, and courses that are coming, and we are currently working on it. We have calls for develop programs like more idea formation that we are going to expect it in January 2022. And then we have programs for companies to participate in the programs that have been created during this idea formation stage. And it's to be announced by maybe at the end of the first quarter or beginning of the second quarter of 2022, we're going to have more details about this. But as you can see here, all the calls on this pillar are related with the access to knowledge, access to market, access to stakeholders, and access to investors. For entrepreneurial experts and for startups. So we have trainings such as mentoring, coaching network, bootcamps activities. We have Bridget-head activity that is related with access to market. And well, we have the EIT Health Catapult, and then we have for investors, we have a wildcard or crowdfunding and investor networks. So what I would like to share here are some success stories. For example, with the EIT Health Catapult program that are opening in January, okay, 5 Ireland, UK startups reached the final stage on this program, and they have secured a place in the finals at the EIT Health Summit 2022 that is going to be in May in Stockholm, in Sweden. and where they will go head-to-head to their share of the 200,000 euros investment prize fund. And another case, and I want to share, is about our Gold Track Accelerator programs that has led to companies raising over 250 million and achieving 4 exits, totaling over 1 billion euros. And now I would like to talk about the new call for the innovation pillar. This call will be launched in April 2022. And what kind of projects do we have here? No? We are looking for projects that are not just research projects. We are looking for projects in advanced phases and close to the market. So we are looking for new products and services, whether if they are medical devices, digital health, or biotechnology for diagnosis, or two related with how to restructure the existing to improve health systems. And this is linked to reforming health system to make them more resilient and more effective and efficient. So how do we identify that the project is not a research project? Well, we have here the innovation cycle that you can see here in this slide, in which you can see that there are 4 different dimensions that we are taking into account. Technology, regulatory, market business, and clinical. So technology and technology readiness levels, of course, we are looking here for high TRLs. But also we need regulatory, business and market and clinical level should be advanced in this cycle. So in this way, our objective will be to continue advancing in these 4 dimensions. And in this way, we can have the solution on the market as soon as possible. It's important to note that they are collaborative projects with consortiums from different institutions and at the European level, of course. For you to have a guiding idea, these projects are normally financed with 2.5 million euros per consortium, representing the 70% financing of the total activity. And in previous calls, they were 3-year projects. But at this moment, as I say, we are working and defining all the details. So it's important to highlight that there may be some changes in this call. But soon we are gonna have more details about this new and excited call. Yes, and up to here, this is what I've prepared for today. And I leave you here my contact and my email. And I also leave you the link to our social media and networks. On our website, you have all the information available about our programs. All the information related to the new calls will be available for sure at the end of December. And also here, I put the link in case you want to subscribe to our newsletter, because we are gonna be periodically communicating all the news, deadlines, calls, and everything that is important to have in mind. And yes, thank you very much for being here today, and thank you very much for your attention. Thanks.
Thank you very much, Lucia, and for keeping so well to time. Now, we're going to hear from Sasha Huben-Tobler, who is the NCP in Switzerland, and she wants to let us know about the situation in Switzerland. So over to you, Sasha.
Thank you, Kay. Good morning, everyone. I just share my slides. So thank you so much for letting me participate, and for just now you should see it in the full view. I hope you do. So thank you for, can you see it? Thank you, Kay. Thank you for giving me the opportunity to participate, and thank you so much for giving me the opportunity to talk here. Hello, everyone. I am presenting the status of Switzerland to the Horizon Europe program, now today to the Cluster 1 program. The reason for it is that some of you have already collaborated in the past or are collaborating with scientists working in Switzerland or have worked in Switzerland. Our status has changed, and we would like to inform you on this so that the collaboration within these Horizon Europe projects can continue with Switzerland. So at the moment, we are not associated to Horizon Europe. We are a non-EU country, and at the moment we can participate as so-called associated partners from non-EU countries. This means we can continue collaborating with you. Switzerland is extremely successful in the health program. We are in the 10 most successful countries participating in these projects, but at the moment only as associated partners. So what does that mean? That means that you can keep us on board of your consortia or have us on board of a consortia as an active, we can play an active role in the project with tasks and deliverables. This role needs to be described in the proposal. We can lead work packages. What we cannot do at the moment is we cannot coordinate. We cannot sign the agreement. The contract. What we can sign is the consortium agreement or a separate collaboration agreement with either the coordinator or with the partner with whom we are working in the work package. Our costs of an associated partner from Switzerland is covered by the Swiss national funding. This is guaranteed. If you have a proposal submitted and this proposal is evaluated successfully and is invited to get funded, then automatically the funding for the partner working in Switzerland is provided by the Swiss government. You have all this information on our national website, horizoneurope.ch, also with a guarantee letter that the funding will be provided to the partner coming from Switzerland. Then we have from U-Research, where the national contact points are in Switzerland, we have a website. And on this website, you find fact sheets and templates, how such a collaboration agreement could be written, where to put the budget indication of the partner from Switzerland. You find all the information and the templates here, or you're more than welcome to contact us and we answer the questions that are still open. So the bottom, the message here, the bottom line, which I would like to take before I'm finished is, please, please continue collaborating with us, keep taking us on board, or keep working with us, discussing proposals and consortium, because the funding is there. Thank you very much for your attention and for questions. Please don't hesitate to ask me.
Thank you very much, Sasha. That's great to hear that. And as you know, we have a network of NCPs across Europe so that we can always be able to contact one another as well. And we'll take questions at the questions and answers in the next section. So I'm just going to share a quick slide on UK participation as well, so to balance things up a little. So the for the UK, sorry about this. Yeah, for UK participation, the UK we're hoping to become an associated country to Horizon Europe following, and that would allow UK participants to have the same rights as EU participants with some very limited exceptions of some areas they didn't get involved in. So as an associated country, the UK entities would be eligible for funding at the same rates and under the same conditions. They could lead project consortia and they could count towards the minimum number of countries in calls for projects. But because now there is a delay to the UK becoming an associated country, the UK government has guaranteed funding for the first wave of eligible successful applicants to Horizon Europe. So these will be people who have applied in the first round and hopefully in this round coming up as well. So the funding will be in place until the EU formalises the UK's association, and funding will be delivered through UK research and innovation. And in the event that the UK is unable to associate to Horizon Europe, the funding will be instead go to the UK government R&D programmes, including those to support international partnerships. So for the moment, you can still include UK partners because they'll be paid from their own UK government funding until they're an associated country. And they're very anxious to become an associated country, and the European Commission is as well. And there's a a questions and answer document on the European Commission website, and I'll include it in this slide as well so you can read about it. Thank you for that. Now we're going to have a 10-minute break, and I'll ask you all to come back at 11:44, and then we'll have some further presentations. So now you can take a break and have a coffee. Thank you. You're all very welcome back, and now we will start with the next section of our webinar today. And first off, we'll have Dr. Amanda Daly from the HRB, who's the national focal point for the EU for Health programme, and she's going to present the calls that are open at the moment. And over to you, Amanda, and we can see your slides.
Thanks very much, Kay. That's great. Good morning, everyone. My name is Amanda Daly, and as Kay pointed out, I'm the national focal point for the EU for Health programme in the HRB. And I just started in June this year, so I'm delighted to meet you all here today. I'm going to give you a brief overview of the EU for Health programme and some of the funding opportunities that are currently available under the 2021 work programme. Okay, so EU for Health is one of Europe's responses to COVID-19. It's the new and reinforced EU public health programme, and compared with its predecessors, it's much more ambitious. It has a budget of 5.3 billion euro, and which is over 10 times the previous programme. And this investment has been made, and the idea is to address challenges highlighted by COVID-19, but even to go beyond this and to invest in keeping people healthy and active longer and empowering them to take an active role in managing their health. I'd like to point out at this stage now that EU for Health is a completely different programme from Horizon Europe. Unlike Horizon Europe, EU for Health is dedicated to health, but it does not fund research and innovation. It supports the implementation of European policies and best practice. For example, there are a number of actions under the current work programme that support Europe's Beating Cancer Plan, and I'll touch on the different policy objectives of the individual calls as I go through my talk. So there are 4 general objectives for this EU for Health programme, and they represent the breadth and the ambitions of the programme. And the first is to improve and foster health in the Union. The second is to protect people from serious cross-border health threats. And then the third is to improve access to medicinal products, medical devices, and crisis-relevant products, but also to strengthen health systems as well. Now, the EU for Health programme was adopted in March 2021, and then the 2021 work programme was published in June of this year, and it has a budget of 312 million euro. Importantly, it supports a broad range of actions with 4 overarching strands, but it has a cross-cutting focus on cancer, and you will see this as I run through some of the calls later. These 4 actions are disease prevention, looking at reducing the burden of communicable and non-communicable diseases, etc. Crisis preparedness, and I suppose we're all very familiar with this concept about strengthening our health systems to fight, potentially new pandemics. The third is the health systems and healthcare workforce. I suppose it's again strengthening resilience and sustainability of the healthcare systems and to reinforce the workforce. The fourth is digital, so it's advancing this digital transformation of health systems, and there's a huge focus already mentioned earlier as well. So I'll just move on. There are different funding mechanisms under this programme that fall under either grants and tenders, but for the purposes of today's talk, I will be focusing on the calls for proposals for action grants. So the second wave of calls for action grants were published on the 14th of October, and 13 of these calls are included here, were launched with a deadline of the 25th of January. And the budget of these calls is nearly 44 million. So I'll just be presenting a high level overview of some of these calls. I'll be presenting 12 of them, which are applicable to the audience today. So I will move on to that. Next, the first call falls under the crisis preparedness strand. And this is aligned, so it's an action grant to support training activities, implementation and best practices under the EU One Health Action Plan against antimicrobial resistance. Obviously, it's aligned with the One Health Action Plan. The call objective is to support enhanced hospital and long-term care facilities, infection prevention and control practices. And activities supported under this call are capacity building by providing training and implementation of enhanced infection prevention and control practices. The outcomes of this call is to enhance primary and secondary healthcare services and improved effectiveness of healthcare systems to prevent infection. So a little bit about the eligibility and funding details. So it's the targeted applicants are public health authorities, academia, education establishments, including hospitals, NGOs, etc. And the budget is there for €7 million up to, and the Commission will fund up to 5 projects with a recommended duration of 36 months. And a consortium is required for at least 3 applicant organisations established in 3 different eligible countries. And I'll just note at this point about the budget, there is a co-funding requirement under the EU for Health programme. The Commission will either fund up to 60% of the action or else up to 80%, and that's under exceptional utility, where you've got a lot of countries involved which are a lower income, so they've lower GNI. You can, but I'll direct you to where you can find more information on this, and I'm happy to take additional queries in relation to this. Okay, so the second call is under the disease prevention strand, and that's the action grant to support the implementation of best practices on the ground to tackle mental health challenges during COVID. And I suppose the policy is aligned to reduce the burden of non-communicable diseases, but also to improve and foster health in the Union. The objective of the call is to increase awareness, knowledge sharing, and capacity building in the area of mental health. And it's to support activities such as the transfer of practices, knowledge sharing, support for health professionals, and development of training material. And ultimately, the outcome would be to implement best practices to address mental health challenges, especially during the COVID-19 pandemic. This is really targeted at NGOs in the field of mental health with a budget of €750,000, and the Commission will fund up to 2 projects with recommended duration of 12 to 36 months. And a consortium is again required for this call. The next call again is under disease prevention. It's for the initiative A Healthy Lifestyle for All. So it's ultimately promotion of healthy lifestyle. And this call falls under the policy objective to implement Europe's Beating Cancer Plan to improve health promotion through access to healthy diets and physical activities. And the call objective is to deliver on this initiative, the Healthy Lifestyle for All initiative. And it's particularly targeted at children. So activities supported are to create a healthy school environment, to increase opportunities for regular physical activity, to promote healthy lifestyles by exchanging best practices on health literacy, etc. And the expected outcomes would be the creation of healthy school environments that promote healthy lifestyles with a spillover effect on the whole community. So that, you know, it would be promoting investment in active mobility infrastructures and healthy canteens and activities such as that. So the applicants are the targeted applicants are civil society organisations, but also member state authorities and established networks in the field of public health, with a budget of 4.4 million. And the Commission will fund up to 3 projects, up to 3 years in duration. And there's no requirement for consortium for this call. The next call again is under disease prevention, and it's a call for boosting cancer prevention through the use of the European Code Against Cancer. And again, it aligns to Europe's Beating Cancer Plan, but ultimately to improve health literacy on cancer risks and determinants. So the call objective is specifically to improve access to and understanding of the risk factors and health determinants to improve health outcomes for cancer. The activities that are supported under this call will be to train, pilot and promote the use of this an app for the European Code Against Cancer amongst the general population, but also to develop and share best practices to strengthen health literacy in cancer prevention and care programs with a focus on disadvantaged groups. So the expected outcomes are increased usability of this EU mobile app for cancer prevention, and the launch of a project to increase health literacy for cancer prevention and care. Again, we've got a mix of targeted applicants, but include academia, NGOs, health and public health professionals, with a budget of, so there's two projects under the different strands. One, it's 1.5 million for the first strand and 1 million for the second strand. And there's no consortium required for this call. The next call is to support actions to improve access to human papillomavirus vaccination. The policy, again, is aligned to Europe's Beating Cancer Plan flagship initiatives, and that's really to roll out HP vaccination. So the call objective is to contribute to this plan, which aims to support member states to extend the rollout of routine HPV vaccination of girls and boys to eliminate cervical cancer and other cancers caused by HPV in the coming decade. And I suppose the activities supported include targeted meetings and workshops and other initiatives to share information with national and regional authorities of member states. So there's this idea that you would promote the ideas of how best to roll out the HPV vaccination. The expected outcomes is the improvement of vaccination coverage of the target population and a reduction overall in the incidence and mortality of cervical and other cancers caused by HPV. Target applicants include civil society organisations, associations, NGOs, etc., with a budget of 1.2 million to fund one project with the recommended duration of up to 36 months. Moving swiftly on to the next call is an action grant to reduce liver and gastric cancer caused by infections, and again to support the Europe's Beating Cancer Plan to prevent cancers by infections. And the overall call objective is to reduce the risk of liver cancers associated with infections caused by hepatitis B and hepatitis C viruses, and the risk of gastric cancers caused by Helicobacter pylori. So this, the activities supported are to develop specific approaches targeted to support vaccination in the case of Hep B virus and to drug treatment in the case of Hep C virus and Helicobacter pylori. So specific activities will be dedicated to the early detection of these infections also. And the outcomes of this call will be a reduction of incidence of Hep B infections and chronic diseases, and the reduction of Hep C and Helicobacter pylori related liver and gastric cancers, respectively. Again, the targeted applicants are quite broad, including education and academia establishments, research institutes, member states authorities and public health professionals. And the budget is 2 million, and the Commission will fund up to 2 projects. And the idea is that one will be targeted to hepatitis B vaccination and hepatitis C vaccination, one targeted to Helicobacter pylori, work on that with a recommended duration of up to 3 years. And no requirement for consortium here. The next call is on an action grant to support EU cancer treatment capacity and capability mapping project. So this is to support another of the flagship initiatives of Europe's Beating Cancer Plan, and that is to deliver high quality care and links also with European Health Database and the European Digital Cancer Patient Centre. And the overall call objective is to map and share different capabilities and expertise available across the Union. And the activity support will be the identification of different capabilities and expertise available across the Union, and build, I suppose, the foundation to regularly identify gaps and needs to be addressed at national and regional levels across the Union, with expected outcomes to result in facilitating the delivery of high quality care and reduced inequalities across the Union, while enabling patients to benefit from diagnosis and treatment close to home. This is targeted again at academia, public health, with a budget of 1.2 million to fund a single project with a duration of up to 3 years and no consortium required. The next call is to support computer-aided drug repurposing for cancer therapy project, again aligned to Europe's Beating Cancer Plan, objective to ensure high standards in cancer care. And the call objective is to identify potential viable effective anti-cancer drugs by making use and piloting in silico drug repurposing, including upscaling available innovation using advanced computing and new big data technologies and high performance computing, and ultimately reducing timeframes and development costs of this drug development. And the activities supported include the launch of an EU platform based on computational drug networks to predict in silico the efficacy of approved drugs against cancer targets. And ultimately, the expected outcomes would be to result in a better prediction of the efficacy of approved drugs against relevant cancer targets. The target applicants include academia, research institutes, member states authorities, and public health professionals, with a budget of 3 million to fund up to 2 projects with a project duration of up to 3 years again. So the next call is action grants for cancer diagnosis for public health, cancer diagnostics and treatment for all genomics for public health projects. So this is kind of split in this call is split in 2, again, to support the implementation of the Europe's Leading Cancer Plan to ensure high standards in cancer care. And the call objective is to improve access for individuals and cancer patients and survivors, prevention, diagnosis and treatment of cancer through personalized medicine by upscaling available innovation in the field of innovative cancer diagnosis and treatment. So again, the 2 projects, the first one is Cancer Diagnostics and Treatment for All initiative, and that will use next generation sequencing technology for quick and efficient application of personalized cancer treatment or diagnosis and treatment. And the Genomic for Public Health project is expected to scale up the 1 million genome initiative results to translate them into implementable public health measures to address cancer preventions. And the outcome would be then to help member states develop guidelines and recommendations to better determine who and what to test, to organise health services to implement genetic testing, and provide specific education and training for health workers to advance understanding of cancer control. So I suppose it's moving the personalised medicine into the clinic and providing recommendations for that for hospitals. So the targeted applicants, similar profile there, academia and education establishments. There are separate budgets for each of these projects, 3 million each, and one project will be funded in each different category with a project duration of recommended of 24 months. There's only a couple more left. I'll just run briefly through them. So that the next one is an action grant to create a cancer survivor smart card, and again aligned to Europe's Beating Cancer Plan, and also the European Health Data Space and European Cancer Patient Digital Centre. The call objective is to improve the quality of life and health status of cancer survivors, to address their potential needs through the development of support for the wide use of new approaches to communication. And the ideas behind this is to develop, deliver and use the personalised cancer survivor smart card. So a smart card is an app that would contain a cancer patient's medical information, and then they'll be able to use that and to give it to other healthcare professionals when in different medical settings. And this will be very relevant for childhood cancers, where they're moving from different hospital settings from the childhood hospital then into an adult, so that there would be a history of their medical records. So the outcomes would be to improve this patient-centered communication between cancer survivors and health and care providers through the wide use of these communication tools and new approaches to communication to improve their overall quality of life. Again, academia and education establishments, public health professionals are eligible to apply. There's a budget of 1.8 million to fund a single project with an expected recommended project duration of 24 months. The next one, next grant is to support the implementation of best practices in community-based services for HIV and acquired and AIDS, tuberculosis, viral hepatitis and sexually transmitted infections. And the policy objective is to support the prevention and monitoring of communicable diseases. The call objective is to support and strengthen community-based service organizations in implementing people-centric, effective and integrated interventions, as well as linking with high-risk groups. So the activities supported include the expansion of this community voluntary testing, early diagnosis and linkage to care of HIV, AIDS, TB, viral hepatitis and sexually transmitted infections. So there's about activities are to support scaling up of tools and consolidation of existing networks. And the expected outcomes would be this integrated community-based health services. So it's linking up the healthcare system with community-based services. And this is again targeted at civil service organizations, but also any legal entity. Any legal entity can apply to this call. There's a budget of 5.5 million, and they will fund up to 5 projects. We're on the last call, because I know I'm running out of time here. So just briefly, this is action grants to organise and collect data to understand the safety, quality and efficacy of therapies applied in the field of assisted reproduction and based on hematopoietic stem cells. And it's to support the policy priority to respond to the COVID-19 crisis. It's the call objective is to collect and organise data on the safety, quality and efficacy of these therapies. Again, supporting, so the activities supported would be to support data collection, aggregation and analysis on the use and outcome of therapies in the field of assisted reproduction and hematopoietic stem cells. And the outcome would be to upgrade digital registries with higher quality data entries across the Union. And there's 2 different topics for this with 2 million each. And that's targeted at applicants, professional associations, foundations and NGOs experience in the field of assisted reproduction and hematopoietic stem cells. So that was a brief overview of the calls currently open. I hope I didn't run through them too quickly, but there is a call document and with much more detailed outline of each of the different calls. I just wanted to mention there that we're at the moment, the work for the 2022 work program is very advanced, and it's likely that this will be adopted either later this year or very early in the new year, and the calls then will be launched quite quickly after that. So if you are interested in this kind of program, I would please sign up to the HRB website. All of the calls will be launched and you'll be informed of any of the calls. There's also a dedicated EU for Help information page on the HRB website. The link is there. Sorry, it's in blue, so it's hard to see. My email is amanda.daly@hrb.ie, and please contact me if you have any queries or just have any questions about any of these calls. So that's all from me, Kay, with 2 minutes over. Sorry about that. Are we taking questions now, or is it at the end?
No, at the end, yeah.
Okay.
Thanks very much, Amanda. That was great.
No problem.
And you've kept very well to time. And now Patricia Clark is going to talk to us about the cancer mission. So over to you, Patricia.
Good afternoon, everybody, or still good morning. As I mentioned earlier, I'm Patricia Clark. I'm the National Delegate for the Health Cluster in Horizon Europe. And I'm going to talk to you today just about one of the new instruments in Horizon Europe, that of missions. And this will be a really, really quick insight into it in 7 minutes, I think it is. But I think there's probably scope for a dedicated discussion on the cancer mission itself at a later time. So really, the missions, there are 5 missions that will address major challenges in Europe. And these challenges are related to adaptation to climate change, restoring oceans and water, climate neutral and smart cities, and healthy soil, and also cancer. So missions themselves are a new collaborative way of working across EU policy areas, bringing together several of the EU Commission services together to work towards a common goal with a defined impact. They're rooted in research and innovation, but they use a portfolio of different measures and tools to actually drive the actions. And these can include research and innovation calls, policy measures, legislative initiatives, and coordination and support actions. The missions are there really to provide the right conditions and funding to enable researchers, businesses, policymakers, industries, and citizens to work together within a specific timeline, and in this case, a 10 years timeline. And then the missions directly support the EU strategic priorities. So in this instance, the mission on cancer will support the Europe Beating Cancer Plan. Cancer has been a research focus in Europe for quite a while, with over 3 billion invested in the European framework programs to date between 2007 and 2020. During the next period, the 2021 to 2027 phase, there'll be substantial new resources made available for cancer through a series of funding instruments that will work in synergies across a range of EU programs. So the research instrument is the cancer mission itself, and it proposes a whole of government approach, focusing on the patient and maximising the benefit of new technologies and insights, strengthening cooperation and opportunities for EU added value, eradicating inequalities in access to cancer prevention, diagnosis and care, and delivering improved health outcomes for patients. The specific objective of the mission on cancer is to improve the lives of more than 3 million people by 2030 through prevention, cure, and for those affected by cancer, including their families, to live longer and better. There are key actions areas that have been identified. And I've listed the 4 of them here. The EU Commission formally adopted the missions on the 29th of September, when they published their EU communication and implementation plan for cancer. And I can't stress enough that this implementation plan is a key document here, and it's the framework upon which all of the calls will be developed. So there's a lot of this work that hasn't been published yet, and it's still being developed, but it is documented and it's rooted in that implementation plan. And there is a reference to that at the end of this presentation, so you can access it directly. As I mentioned, there are 4 specific complementary actions that the Mission on Cancer will detail in annual work programs. And these include the understanding of cancer, prevention and early detection, better diagnosis and treatment, and better quality of life for patients and their family living with and after cancer. There are also a number of horizontal actions here, including ensuring equity and access to knowledge, research and care, promoting innovation, addressing childhood cancer and personalised medicine, engaging with the cancer community, including citizens, patients and society at large. And I'm just going to draw your attention to the areas that are already in work programme for 2021, will be in the amended work programme for 2021 and future annual work programmes. So the initial Mission on Cancer work programme was published in June 2021, and it had a single coordination and support action, the ucan.eu digital platform. And this call is now closed. It closed in 20th of October. It had a budget of 3 million. It wasn't research, but a coordination and support action. And it aims to fund one project in Europe that will underpin all of the mission priorities that require a better understanding of cancer. It is to agree a strategic research and innovation agenda across relevant stakeholders, to look at integrating innovative models and technologies with longitudinal patient data, patient samples and biomarkers, and to allow for the data interoperability and reutilization of all of that data. And each of the missions is starting with an underlying sort of CSA that will look at the resources that are there available at the moment, and particularly focused on the data area. Within the area of understanding of cancer, there are 3 other areas outlined in the implementation plan, and these include research on healthy versus cancer cells at individual and population level, cancer patient molecular cell and organ interactions, and determining the role of genetics in cancer. Moving to the prevention area, we can see here there are also 4 areas of work outlined in the implementation plan, working with the JRCC Knowledge Centre on Cancer, observation studies on risk assessment, observation and late-stage clinical trials and implementation research, and sustainable procurement actions. Focusing on the screening and early detection area, again, we see there are 3 areas flagged for attention under the mission, and these include access to existing screening programs, new methods and technologies for screening and early detection, and developing early predictor tests. In the 3rd area, the diagnostics and treatment, we foresee actions related to the creation of the network of comprehensive cancer infrastructures, developing twinning programs and cancer trials programs in diagnostics and treatments. And then just looking at the quality of life area, again, there will be sort of measurements of quality of life for cancer patients and survivors developed, supporting the establishment of the European Cancer Patients Digital Centre, developing earlier predictors for quality of life, and designing monitoring programs for survivors of childhood cancer. Again, none of these have been published yet, apart from the UCAN, but they are detailed in that implementation plan. And there is an amendment to the Cancer Mission Work Programme to be adopted before the end of the year. So really need to keep an eye out for that one, and we will flag it with you both online and with anybody who is interested. Want to add that there will be an information day on the updated Mission Work Programme 2021, held on the afternoon of the 18th of January 2022, where the EU staff will actually discuss the new amendments. So that's not public yet, and the details haven't been shared, but we will again share details of that so that you can register for that discussion in January. And I just want to leave you really with a couple of slides on the kind of complexity of this area and where cancer fits in across the EU programmes. There is an ecosystem for cancer that's being built on synergies and complementarities across a number of EU programmes. And what I've listed here kind of are the building blocks really that need to be built in different areas to build the complete picture for cancer and the support that's been developed in Europe. So you can see here some that initiatives that will help to achieve the mission on cancer, some that act as an enabler for cancer, and others where the mission on cancer are expected to serve, such as the AI agenda, the European data strategy, digital transformation and skills, and the newer European Bauhaus initiative. So it's a really, really complex agenda to coordinate at EU level, and that's even before we look at alignment at a national level and EU level combined. And I know Marta is going to take you through some of those programs there, and we'll probably touch on some of the different areas in the next presentation. The final thing that I would share is really around, there are some interactive tools that are there to help you understand. So here I've just shared the visualization from the EU Knowledge for Policy interactive tool, and it allows you to look at the different areas of prevention, screening, diagnostics, etc., and to look at what's been covered in different programs. So you can click into it and see, you know, what's been addressed in the different programs and how they all fit together. So there are some good resources that are being made available. And just a final message on governance. Again, in line with the complexity of the agenda, there's quite a complex joint governance structure in place. I've listed some of the main advisory implementation stakeholder dialogue details here. On the stakeholder group, it's run under the EU Health Policy Platform. And it's a basis for discussion and exchange that's open to everybody. So on the 24th of November, there was a webinar which jointly looked at the Europe Beating Cancer Plan and the Cancer Mission, which was attended by over 600 stakeholders. Just also flag that there's a new board being put in place for the Cancer Mission, and we would expect that there will be an expression of interest call for a board that will focus on the implementation of this mission, either before Christmas or directly after Christmas. In terms of next steps then, again, If you're interested, save the date for the afternoon of the 18th of January. There'll be 2 days that the Commission dedicate, the 18th and the 19th, to looking at all of the missions, but the cancer mission will be addressed in the afternoon of the 18th. As I say, there's a second amendment of the work programme for cancer 2021 being finalised and should be adopted before the end of the year. So really look out for that, because the deadline for those 3 new RNI calls will be the 26th of April. In parallel, the EU Commission has already started to look at the work programme for 2022. And again, it's hoped that the work programmes will catch up as such, so that they can be aligned across the Horizon Europe timeline and the cancer mission timeline. And finally, just to leave you with some references that you can check afterwards, absolutely stress the implementation plan. There's been a foresight on cancer, and there's also a link to the Knowledge Centre on Cancer. Thank you very much.
Thank you, Patricia. That was great. A very comprehensive summary of the cancer mission. And now I'm going to hand you over to Martha Cahill again from NSR, who's going to talk to us a very quick summary on a number of things. She's going to talk about the EIC Digital Health, the Health Innovation Initiative, and then we'll follow James Walsh will follow to talk about EEN. Now, we just want to give a quick overview of some of these things, and as Patricia said, we probably, if there is interest, we can give dedicated events to some of the things we covered today. This is just to give you an idea of what's involved. And Martha will have links in her slides as well to the people, the contact points that deal with a lot of these, such as Sean Burke for the EIC. So over to you, Martha, for your talk. Thank you.
Thank you, Kay. So I'm going to start where I ended the last time and just recommend that people sign up to the newsletter. And the reason for this is that the landscape for health research is going to get very complicated in the next year. Primarily in the last year, we've only had to deal with the health programme. You've already had an update on the cancer mission from Patricia, the EU for Health programme from Amanda, and I'm going to cover 3 new programmes which have different opportunities for health research as well. The Digital Europe programme is launched and closing in February. There's 40 million euro worth of opportunities there. The EIC programme, traditionally we look at about 30% of the overall budget on the EIC programme goes to health, technology and activity. If you're conservative, that's a 2 billion budget we could potentially draw from. And the Innovative Health Initiative is also going to come on stream next year. I'm not even going to talk about HERA because that's another activity that's still going on in the background, but they could present other opportunities in the next year as we go along. So I'm going to firstly start with the Digital Europe programme and the topics for 2020. Now, hands up, this is completely new to us. We're still digesting all of the material, and I'm going to link you to a webinar that's going to update you on the topics that I'm going to discuss on this. So the Digital Europe programme is a 7-year programme that is literally focused on the digital transition. It is 7.5 billion. It'll cover many areas from the cloud, infrastructure, artificial intelligence. The first budget for the first 2 years is 458 million and is now open with a closing date mostly for February of next year. So as I said, these are the areas that it covers. This is a nice illustration. It also looks at things like advanced skills, which is complementary to the EIT and some of the activities that they presented this morning: high performance computers, cyber security, data, cloud and AI. So in the area of health, these are the topics that are open. Okay, so under the area of data spaces, you have an open call on genomics. I'm going to go through these in a second. In the second call, you will have a data space that's going to focus on cancer images. I haven't fully digested this area yet, but again, there's going to be an opportunity there for health in the testing and experimentation facilities, and that's going to be in call 2. Again, I need to get under the bonnet on this one, but these are the open calls that are marked in red. Under accelerating the best use of technologies, you're focusing on the uptake of digital solutions in health and care, and then you have an ecosystem for digital twins and healthcare. As I said, there is a webinar that's going to happen. That's next week. It's on the 14th of December. And you can actually get the details at this link here. We'll obviously send you the presentation afterwards. That's where I'm going to be gathering most of my knowledge. Okay, so just to talk about what these are. Okay, so the first topic is the Federal European Infrastructure for Genomics Data. This particular link here will bring you directly to the call page. Essentially what this is about is bringing all of the genomics data sets together. So these could be data sets that may relate to different diseases, rare diseases, for example, and basically trying to get an infrastructure where they all can get together for future research. And this is particularly important in the area of rare diseases, where you need a cohort across Europe to actually make meaningful extractions from data. So this particular project is a co-fund, and it's up to 20 million. Okay, so very much talking about linking together different ministries and cohorts of data. The second one is on an ecosystem for digital twins in healthcare. Essentially, this is the digital twins that mimic different disease areas, and it's about linking them all up. The objective of this is to create a digital twin for the entire human body. So it is a very ambitious task. This is a coordinated support action. So it's about having that discussion. How do we do it? So maybe standardizing the data as how and structure of how you bring these digital twins together for an entire human body. Okay, and that's €1 million in funding, and it's more about the discussions on how to achieve this. The other topic here is the uptake of digital solutions in healthcare. Again, this is a CSA, 100% funded. One of the issues with digital solutions for healthcare is very often there's a lot of solutions out there, but they're not taken up or integrated very well within the healthcare system. And how do you ensure that this is done in a meaningful way? They also talk about telemedicine, independent living, and large-scale development in this, because as our population ages and we have more and more pressures on the hospital system, as you've seen with COVID, we need to move towards telemedicine and independent living. So that's the focus of this CSA. In the second call, and I want to mention it today, even though I haven't gone into the details so much, it's about the Federal European Infrastructure for Cancer Imaging data. So basically, again, this is about linking up different silos of database centers and imaging, I suppose, infrastructures within Europe, so that you can make more meaningful analysis and do more meaningful research in this particular area. And again, this is very complementary to what Patricia's presented on the European Beating Cancer Plan and the Cancer Mission. So that's 18 million. It is a co-fund, so it's about maybe half funded by health ministries, or in our case, someone like the HSE, for example. So there's a very, very good book and resource, a report that was launched as well around this. It talks a lot about the European health data space. So these particular projects are actually about addressing some of the issues that are being raised in these particular projects. And again, we're all on a learning curve with this one. So we will be able to tell you more as we are kind of digest all of the details in this particular project. It has only come to us over the last few weeks. There is a work program, and there's links here to the work program, and the call documents are very important in terms of the information that is available on this. And there's a very different model grant agreement, so there's a bit of work to digest all of the information that is out there, and I haven't, as I said, fully digested that yet. But keep in touch if you're interested in any of these areas. We can talk about it again. Now I'm going to talk about the EIC program, which is my second different program, very different again. My colleague Sean Barker couldn't present this today because they have a program committee meeting, so I'm going to do a very short summary, mostly related to the health challenges that are going to come up in 2022. So this is a very simple version of what is going on. There's many programs within in the EIC. There's primarily the EIC Pathfinder, which works on early stage breakthrough ideas, generally involving collaborative research. Researchers, technologists, companies all get together and actually look at science and breakthrough technology. So that's collaborative research. The EIC transition, this is very much in pilot phase, but this is the next phase where you're actually starting to move that technology towards the market, or basically towards the set of a company or an entity to exploit that. The EIC accelerator is basically the scaling up of these type of activities, very often we have companies in here that focus on clinical trials and clinical activities and testing. So this is about scaling up of that particular innovation. And as you can see, there's a different TRL as you move across. So just to explain, this is almost consisting of about 6 different programs, because what you have is each of these particular programs have an open call. So anyone who is interested can compete in an open call. So health technology companies or health technology projects can compete, but they are competing with the likes of quantum or environmental projects and everything else. And it's all okay. We do quite well in that space. But what has happened differently last year is they have identified challenges, which is kind of like a top-down approach where we want you to do research in this area. And these were the particular challenges that were in the program last year. And I'm listing these simply because these are particular areas that the EIC want to build a portfolio of companies and technology capability around. In this year's program, okay, you have new challenges. And I've been reviewing this with Sean. And so in the area of the EIC Pathfinder, you have cardio genomics. There's a project coming up on that. Second project is towards the healthcare continuum, technologies to support a radical shift from episodic to continuous healthcare, regenerative medicine and tissue engineering and DNA based data digital storage. There's a deadline outlined in the draft text of the 26th of October next year. So anyone is interested in these particular projects, make contact with us, and we will, the call will be published fairly shortly anyway. This is all for 2022. The EIC transition actions are going to focus on RNA-based therapies, diagnostics for complex, rare and severe genetic diseases. So that's the project that's going to be in there. And as before, the transition actions need to have previously been funded by a Pathfinder or the predecessor, the FET Open projects as well. So finally, then the accelerator project, again, there's a bit of a long description here, and they're focusing on projects where they want to build strategic autonomy in Europe. And if you look down through the text, you'll see the ones that are relevant to the area of healthcare. These are basically systems for pharmaceutical industry, improving the supply through synthetic biology and novel manufacturing technologies. There's also projects around strategic healthcare technologies. Again, they're trying to build strength here in the area of cell and gene therapies and RNA-based therapies. So again, there's opportunities in this particular area. So this is a summary that's actually from the draft text. So this will give you an idea of the timelines. I know it's quite difficult to see, but there is a specific budget for EIC health challenges, and that makes it quite, I suppose, attractive in terms of if you fit into this call, these are the projects this is the program that you should be going for. And I'll leave that summary there. I know it's quite hard to see on a screen. The oracles behind this is Sean and Jill. So these are the people that you need to have an in-depth chat with if you're interested in these particular topics. Now I'm going to move on very quickly onto the Innovative Health Initiative. This will launch in 2022. The Innovative Health Initiative is the follow-on for the Innovative Medicines Initiative, which is a public-private partnership with industry. Unlike the Innovative Medicines Initiative, the IHI is going to be much, much broader in scope. The Innovative Medicines Initiative was done in partnership with FPA, which is the pharmaceutical industry. IHI brings much wider scope of industries together. So there's 5 different industry groups involved. There's going to be a wider span in terms of the research for pharmaceuticals, diagnostics, medical devices, imaging, biotech and digital industries. And there's 2.4 billion of a budget there, 50% coming from the Horizon Europe program and 50% coming from the industry side. You can find some more details on the preparation work and a strategic research agenda at this website. It is anticipated that this will launch in June next year. I think we haven't got exact dates yet. These are the industry groups involved, and this is a link to the strategic research agenda. Definitely worth taking a look at, because what they're detailing is what they're aiming to achieve. They're going to focus on 5 different areas: diagnostics, drugs, devices, delivery and data. And they actually specifically outlined their objectives. one of their goals is to launch at least 30 large-scale projects in the area of health innovations over the duration of the program. And the other is at least 5 examples where they're integrating healthcare products and services and demonstrable suitable uptake in healthcare systems. So that's another ambitious goal. And they're also going to look at cross-sectoral health innovation that supports the EU digital strategy and the pharmaceutical strategy of Europe. So they've laid out their stall as to what they want to achieve over the next couple of years. There is going to be a mix of different stages in this as well. We're going to have one stage call because some of because the nature of this partnership is a little different. Some of the industry groups have small companies in them, and they can also participate in single stage calls. So you're going to have smaller projects and larger projects, and some of those companies will actually also benefit from it, but more detail will be revealed as we progress forward. So this is my last slide. So where they are at the moment is all of the partnerships in Europe that are similar in nature, these joint undertakings, all fall under now a single basic act, which is the governing structure for this, the new legislation, and that was adopted in November. Now, this has been something that has delayed the start of this program, but I think it is actually now at the stage where we're going to move quite quickly. What's happening now is IHI are going to take over all the responsibilities from IMI2, and that entity will cease to exist, and all of the projects that are in existence will be managed by the new IHI office. A new board of representatives is going to be formed with industry representatives and the EU Commission, and also the state representatives groups will be formed. I believe I will be the nominated state representative on this. And then also there's going to be a scientific and innovation panel selected. It's going to be much wider in scope given the nature of the projects that are going to come out of this particular activity. They're anticipating that the first calls will be launched in Q2 of 2022. And they have a new website coming on stream, which is ihi.europa.eu. If anyone wants to keep an eye on that, it's not up and running yet, but it will come shortly. So that's where I am. And if you need to contact me for any reason, my details are there, and I'm happy to talk to you about any of these programs in detail at any stage. Thank you.
And now James Walsh is going to talk to us about EEN. Thank you, Martha.
Hi, everyone. Thanks very much for having me on at this, I think, of the last slot. So thanks for your patience. And I'm briefly going to give an overview of the Enterprise Europe Network and how it can help you. Now, it's funded by the European Commission. Its mission is to help ambitious SMEs innovate and grow internationally. Now, while the services are tailored towards SMEs, many of them are equally accessible to the research community. And I'm just going to briefly touch on a number of these. So first, what is the network? It's over 3,000 full-time experts across the EU and beyond in over 600 locations, including development agencies, research funding agencies, chambers of commerce, and in over 60 countries. So in-market, local knowledge, and a very established network, long relationships. So it's that piece that's of real value. There is an infrastructure associated with this. So we're funded by the Commission, as I said, but we've got 3 main pillars of activities. One relates to international partnerships, another on advisory supports, and a more hands-on innovation support structure that we provide to SMEs. For the purposes of this meeting, though, I want to touch on a few of these. One is the Commission's and EEN's partnership database, which is basically an enormous database of business and technology and research project opportunities, looking for partners, both B2B, B2 university, if you like, or research community, and sometimes B2C. What we do, and I won't dwell on them because essentially the kind of activities we do, we work very closely with the national contact points in relation to Horizon Europe and other funding events in terms of information sharing and matchmaking. Some of you will be familiar with those. I'll come on to the partnership building piece in the next slide, and on the other activities relation to intellectual property support and alternate information in relation to finance funding. So briefly here, I took a few of these. As you've been hearing all morning, it's complex out there. It's complex from a European perspective. For SMEs particularly, it's incredibly complex. It's complex for startups. So you will have heard of many of these. So what can the EEN do? It can help navigate some of that ecosystem for you using our internal channels, using our network of contacts throughout Europe and nationally. So you've heard today on EIC, Digital Europe, and I was very glad that Marta went into detail on that. So that's one to watch, I would suggest. But aside from the public funding perspective, there's the private funding piece. So from a pan-European perspective, there's the European Business Angels Network, corporate financing, how to source this. We help navigate, we help prep, we help with introductions. The other bit from I suppose, a practical perspective, a lot of these are multi-partner, as you know. Sometimes you just cannot find that partner. So we've basically a system, a process where we can reach out across the network, partly through defined relationships through our own sectoral healthcare team, for example, and look for that partner, that hospital, that university, that SME, that corporate that might be suitable for you to join your consortium. The other piece I wanted to touch on, which is of value, I know we're very much talking about open calls, but as you'll appreciate, it's really how the intellectual property is managed and I suppose commercialized, or at least disseminated. This is a huge point, a very hot topic, as many of you will know. So for many years, the Commission has funded the EU IP Help Desk. It's an enormous resource. The next slide will highlight some of that. And a number of support services, hands-on. Specifically, for example, one new one is the Horizon IP Scan. If you've recently been approved funding, either predominantly aimed at SMEs, how you navigate and work with the research community in particular. SMEs just don't have the competence or deep knowledge. So it's a way to help them smooth that relationship when they are partners with universities and the third level sector. So I won't spend time on this. The website's here. Some of you will be familiar with it, but it's an enormous resource in terms of training. We will host one next year in terms of Horizon Europe IP management and exploitation, and hopefully some of you can attend that and get some inside knowledge. And the only final point I would like to make, like Marta, the best way to really get up to speed is, I would suggest, registering on the Enterprise Europe Network Ireland site if you're an SME or even in the research community. But all of you, I would invite you to follow us on Twitter. This is probably the easiest way to keep up to date in terms of activities. We continuously promote our activities. And thank you for your attention.
Thank you very much, James. And now we'll have our final questions and answer section for all of the presentations that we've had previously. I know Sasha has left and so has Anita, but if you have any questions for them, we can pass them on or try and answer them ourselves. I see there's one question in the chat that maybe Martha, you might. It was about, yeah, they're talking about, it was to do with the
I don't see it.
Citizen science, and it's asking, what about startups? Universities are not capable of developing citizen science, and not one university has a citizen science app or module. So that was just following up on that citizen science question previously. So I don't know about, have you any thoughts on startups, Martha, on that?
I don't know. I saw that question earlier. I'm not quite sure how to answer it, but if that's from Sean, if Sean wants to link in, we can have a chat about it again. I'm not quite sure, sorry.
Yeah, can I just add to that? I mean, I think there is quite a lot of work that's been done on public, patient and informal carers within health research in Ireland, which is being led out of the HRB. So there is a national network that has been set up, which brings civil society, wider society plus patients and their families into sort of the development and decision-making approach for health research in Ireland. I think the Commission has gone down a very open and transparent route to co-creating some of the work and making sure that the resources and their thinking and how they actually approach things actually is open to consultation, wide consultation as well. So there are opportunities there, and particularly within the mission, the intention is that there will be a broad involvement of citizens and wider society. But I think that's probably as much as we can say about that now. Can I just add one thing on the complexity, Kay? Just looking at some of the programs that have been there, I mean, I think it's really important for people to come and talk to the people who lead on these programs and to sign up for the actual newsletter and the resources and use the supports that are there. And just for example, looking at the genomics agenda, which is kind of key at the moment, and very topical in Ireland as well. And so you see where the Digital Europe programme is actually developing sort of the infrastructure and looking at the technology behind being able to query different data sources. So that fits in with the Horizon Europe work programme in terms of looking at health outcomes. So the focus in the research side of the programme will be sort of on how to integrate those different data, sort of the clinical, the research, the genomics data, but really to look at it from a health outcomes point of view. So there are nuances between them all, but it takes a bit from each programme to actually build the full picture. And I think for that, and that may be something that you won't get from looking at the individual texts, and you need to actually talk to the people who are involved in the different programs and are there, engaging with different officials on how they work and how they all build together.
And the only thing I just wanted to share a slide of our contact details. And these are our contact details here. There's Patricia Clark, who's the national delegate, and Patricia has spoken to us. Myself, national contact point in the Health Research Board, and Martha Cahill from Enterprise Ireland. And I just want to thank you all for attending our webinar today and for presenting, and want to thank all the panelists and all those who presented. And the slides and the recording will be available, and you get an email letting you know where you can get the details. And also, if you are signed up to the HRB e-zine, you can get details of the any of the Horizon Europe activities as well, and the same for the EU for Health from Amanda. I would suggest as well that you contact myself and Martha directly if you're interested in applying to one of the calls, and we can have a chat with you about the call and all the details. We can help you through all of that. Okay, well, we'll stop here, and thank you very, very much for your attention and for your input today. Goodbye.